Thanks everybody for being gracious hosts and having us here. We're really grateful as a foundation to be able to be a part of this process. My name is Dr. Edward Mairura. I'm an orthopedic surgeon based in Dallas. I'm here as part of the Mairura Foundation. I'm not by myself. We have 22 other volunteers from the United States. It's a mix of different doctors of different specialties, nurses, physician assistants, and our medical sales representatives. So we have a big team. Some of those guys are represented here behind me and to my left. Some have already started the clinical duties. So as a foundation, our goals are basically simple. We're really just trying to make the world a better place. And so we do that by creating access to healthcare, which helps reduce health disparities. And so that's one of the main reasons we're here, is we're addressing that by providing an orthopedic service. And so the team here is coming in to basically offer non-surgical treatment of some of the most common orthopedic ailments. So you think about things that affect the knee, the hip, the shoulder. And then we're also taking care of some of the fracture patients from motorcycle crashes, or the piki-pikis, as we would say here locally. And then we're also doing elective joint replacements, so replacing people's knees and people's hips. This is our second year here, so we're grateful to have the opportunity to come back. And we've just had a lot of support, and I can see the lines are long, and we're ready to work and help. A lot of the common things that we treat, I think in this municipality, a lot of the stuff is trauma. We're also seeing a lot of deformity problems with bad hips and bad knees. And so, and we also have our hand surgeon experts, so we're going to be addressing issues of the hand as well. So hopefully that answered some of the questions to at least get the conversation going. Yeah. Great question. Last year when we did this camp at our sister hospital down the street at KTRH, we probably did about 40 operations, and we saw about 1,000 patients in the office. My understanding is the numbers are bigger, but we also have a bigger team this year. So I would anticipate, I'm already hearing that we've had upwards of 1,500 patients that are waiting. And then the surgeries, I would anticipate it's probably going to be about 40 to 50.
What about the prevalence of these bone conditions, or in Kenya?
In Kenya, that's a hard question to answer, just because my my expertise is more of an American-based expertise. But I do know, at least where we come and train, it's 1 in 100,000 people. It's very common. Obviously, when you're running a camp like this, it seems like that's what everybody has. I just don't know the stats and the figures, but that's something that's interesting that I'd have to look into to figure out. Yeah.
Age group that is mainly affected by
Yeah, it's interesting. I think in the perfect world, and what you see commonly, at least in the United States, is the elderly, right? So we're having some of those, but we've just finished our word rounds, and we've seen patients as early as young as 19, 24, just from different problems. Yeah, so it affects all common age groups. Yeah.
Thank you for choosing to be with us here today. We are hosting a medical camp that is essentially covering orthopedic needs. And we are so happy to have these within our facility. But first of all, my name is Duncan Musioma, the Chief Executive Officer of Nyanjo Adventist Mission Hospital, where we are today. Some of the issues that have been tackled here, I want to say that the disease burden, or the burden of orthopedic cases around our region is huge. And it's because of several factors. Some of them have already been listed. But basically, outside what has been said, that is about our lifestyle, watching over our weight and being active generally, it's about our health-seeking tendencies. Those who are sick don't have a tendency to go to hospital and seek aid. So we have one today, tomorrow we'll have 2, 3, and the numbers keep surging. And the reason for that is simple. The cost of healthcare has always been high, and the living standards of our people, actually we have a population that is basically poor. And some orthopedic cases, when you do them without such an arrangement as this one, they go to an extent of $500,000 and even beyond. So the people meeting those costs becomes very expensive. And that's why we are so happy to partner with some of our friends, international partners, those people of goodwill who are coming, essentially donating their skills, donating their time for the purpose of extending their love to the people and the community, so that we do this together. So instead of using a lot of money to see the consultants, to have the x-rays done and all that before you even get to theater, all those things have been sorted for you because of this kind of friendship. And then the second thing is that basically in Kisii we have not had an establishment of a facility that takes care of bone issues, spine issues as such. Our people go very far to get these services. And so what we are trying to do through this kind of arrangement is that at some point we bring the services closer to the people through the medical camps. But our bigger dream as an institution is to have a center that will take care of these bone issues, spine issues within this region. And the Mairola Foundation actually has given us kind of a jump start. It has given us that energy that we need so that we can start this service for our people. So this is not something that is ending with this camp. And that's why I want to encourage our people that even beyond this camp, we are going to continue serving you. Don't fear on hearing that already we have 1,500 bookings. The 1,500 bookings, we are going to serve them, but even after the camp, we will make sure that everybody has been served, because the hospital is not going anywhere. And this hospital is there to serve the people as a calling from God, because as you know, this is a church facility. Thank you so much.
With Dr. Marura back in the U.S., you asked a question about government healthcare. The way I see it, every country has their challenges with meeting the healthcare needs of the citizens. Even us in the U.S., it's something that we strive to perfect and improve. That way we can reach everyone, everyone can be treated, everyone can be healthy. So bringing some of what we do there to here is part of that process of making sure everyone can be treated and have a standard quality of healthcare as a citizen of any country. So it's a challenge for everyone. But that's why Dr. Marura has brought the team of people here that we can try to address those challenges. And even back home, our team still works together back home to address the challenges of the healthcare needs of the people in our communities. So I think it's a complex question, but also I think it's a basic answer for anyone, anywhere in the world. You know, these things happen everywhere. All